So when they look at themselves in the mirror, like a woman like this, sees the transformation in the mirror, do they get teary-eyed or choked up?
I mean, I got a few patients that cried after we put the teeth on because of happiness. They were so happy now they could smile. I mean, she wasn't smiling for over 60 years.
Really?
Because of her teeth. So, I mean, it made a huge impact in her life. Randy, you're going to love this next one. Okay. This is one of my favorite. He's an extremely nice guy.
Is that him smiling, trying to show us
that's him smiling. You know, he's a big executive of a big, huge company with thousands of employees that he manages. And these are his teeth, you know. His teeth are all worn down.
They're so short.
It could be due to stress, but these teeth were very short, and his bite was completely overclosed, and we went ahead and corrected the bite. This is what his after looks like.
Wow.
After we corrected the bite and placed all ceramic crowns on these teeth, you know. Look at his face. I mean, his headache went away, his TMJ is gone, his no more soreness of the jaw, no more migraine headache, no more jaw popping. I mean, he is so happy.
Is this one of those things where the patient says, Dr. Golpa, I should have done this years ago?
Yeah, I mean, they wish they would have done it a long time ago because they wouldn't be suffering for all these years.
Is that your message? I mean, anybody, if you don't like your smile, you could do something about it.
You could do something about it, right, exactly. Not only you will improve your smile, but you will improve your lifestyle, plus, you know, if there's any headache or
those things will go away.
Those things will go away.
In many cases.
Everything needs maintenance, just like a car. It needs maintenance, you know.
Fix it up.
If you have to fix it up. If the jaw position has changed over the years, you know, we can bring it back to the ideal position where it used to be.
Now we're just about out of time, so we have time for one more.
Oh, okay, good. This patient, she came to me, she is a model. She was concerned about the front gap and gadgety front teeth, and so it was a pretty simple case, you know.
I mean, when you look at that, that's easy?
That's easy, you know, but you have to have, you know, you look at the lip line again, you know, you have to have the eye of an artist to see what's missing here or what can improve this patient's smile. So, and these are her after.
Wow.
We went ahead and widened the arch slightly, lengthened the front teeth. The teeth looks completely natural. We look at the facial ratio to the teeth ratio, and she has a beautiful smile. She's actually on a cover of a magazine in Ukraine.
What about the process? What can somebody expect? Okay, they don't like their smile, they go in, they meet with you on day one.
They meet with me.
How do you decide what their teeth are going to look like?
We basically, the initial visit, we'll take an impression from their teeth. And, you know, we do a study model on them to see exactly how their teeth is going to look like.
What do they ask you, by the way?
Well, one thing they're mainly concerned about is the shade. The shape, you know, we have smile catalog. We want to go.
So you actually go over catalogs with them?
We go over different smile guide. You know, we go over different smile categories that, you know, that would fit their face.
Do they pick their smile?
I usually pick their smile for them. They usually leave it up to me since I deal with them every day.
All right.
So they leave that up to me. But as far as the shape, the shade. The shade, usually they have a lot of input into it. You know, I give them my input, and they'll give me their input, and then we'll decide what shade would look good according to the color of the skin. I give all the instruction to the lab. We get the model back from the lab, and then we'll go over the model with the patient on the second visit.
All right. So second visit.
Second visit, they'll review the model. Third visit, which is the main appointment, we'll prep all the teeth. And they will get a temporary, which is exactly...
So what is that made out of? So they get
temporary is made out of acrylic, which is basically, it's like another study guide for us, you know, it just...
So they can eat with it?
They can eat with it and everything.
What if they don't like it? So I mean, is this a good time where they say, hey, they're too big?
That's a perfect time for us to decide if we like the temporaries or if we don't like the temporaries, because that's what's going to, you know, that's mimicking...
Do you ever see their teeth, they love it, you go, I don't know, maybe...
Yeah, there's a lot of times that they love their temporaries, but there's something I don't like about it. I make the changes and then they see it, because...
Are you a perfectionist? Do you consider yourself?
I'm extreme perfectionist. I have to love it before they love it.
All right. Oh, really?
So I'm much pickier than any patients, because it's my work that's going to be going out there.
So in a perfect scenario, what's the timeline?
The timeline, basically, when they come in for the initial visit, from the time that they come in till the time we finish the process, it shouldn't take more than 3 weeks.
So 3 weeks, they could have a great smile. So from right now, them watching this in 3 weeks?
Yeah, we're looking at 2 major appointments. one initial visit that they come and see me. Second, 10 minutes visit for them to see the model, to see how the teeth is going to look like. But the main important thing to see exactly how the temporary is going to look like. If they like the temporaries, I like the temporaries, then we move forward. So there is no surprises at the end. Everything is calculated. We know exactly how the veneer is going to look like. We have the shape, we have the shade, which...
so porcelain veneers, right, we're talking about. They're made of glass, right? That's glass.
They're made out of ceramic, right?
They don't stain.
They don't stain because
stain.
they're impressed. They call them impressed veneers.
What about you? You have beautiful teeth. Can I ask you? I mean, do you have a few veneers?
I get few
Let me
veneers.
See you smile.
I get few veneers.
All right. No, but seriously, the fears they have. I mean, what are they afraid of? Or misconceptions out there about veneers that you can lay to rest right now?
About veneers is basically they're afraid they're going to look fake.
Yeah.
They're afraid they're going to look like a horse teeth. They're afraid about they look too bulky.
Yeah.
Or too short, or and
that's
whatever.
The hands of the dentist,
and
you're
that's basically depends on the dentist. It depends on if there's. I don't think every dentist has an eye of an artist. Patient should look for a dentist who's actually does this full time.
Like that's their practice.
Emphasizes only on cosmetic dentistry. If they do full mouth reconstruction, and if they do implants. So if my practice is only limited to a full mouth reconstruction, which basically consists of cosmetic and implants. So
so there's no recognized specialty cosmetic dentistry.
There is no recognized.
So I guess it's tough for the public how to find a specialist.
You have to look at their background. You have to look at their reputation. And you have to look at their how many cosmetic cases they do per month.
You've done thousands though over the years?
I've restored probably over 20,000 restorations of veneers and
Is there a
glass
steep
crowns.
learning curve with cosmetic dentistry?
There's
what does the public need to know?
There is definitely a curve, and it basically doesn't happen overnight. It takes years and years of practice
to get better.
To get better and better, and to be a perfectionist.
Is that something you should ask your dentist though? How many veneers have you done?
One thing, you have to find out how many veneers they've done, and if they show you an album, if there's actually their own patients that they're showing you.
Okay.
So those are the main things that you need to look for. So.
Okay. In your office, by the way, it looks like an artist's office. I mean, it is really nice.
I wanted to make it different. I just wanted to not look like a dental office, so that's why I made it that way.
I want to thank you for coming to the show.
Thank
Very
you so
good.
much, Randy.
Always
thank
a pleasure to have you on the
here.
program.
Thank you so
You've
much.
been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.